Hi, my name is Erin and I'm going to be your student nurse today. Can you tell me your name and date of birth? Pretend you used a hand sanitizer.
Katie O'Donnell.
And your date of birth?
8969.
Okay, now I'm just going to check your wristband. So Katie O'Donnell, 8969, perfect. Alright, I'm closing the door for privacy, making sure the bed is locked for safety. So we're going to be doing a head-to-toe assessment today, if you're okay with that. I'm just going to be going over your vital signs and making sure everything is within normal range for your body systems. So what brought you in today?
My annual physical.
Your annual physical? Alright, so we're going to do a mental status check. So can you tell me your name?
Katie.
And do you know what time it is?
8 o'clock.
8 o'clock. And do you know where you are?
At home.
You're at home, and why are you here?
For my assessment.
Okay, so the patient is alert and oriented ×4, and while I'm talking to her, I'm also assessing her eye contact and her affect as well as her hygiene. How has your nutrition been? How much are you eating? Would you say you eat like the main food groups?
Pretty much, yeah.
So you
3
pretty
meals
much
a day.
3 meals a day. What was your last meal?
Lunch.
And what did you have?
Had a peanut butter sandwich, an apple, and a banana.
Okay. And how do you think you're sleeping overall?
I can sleep a little bit more.
So would you say you're hitting about 8 hours a night or less than that?
Less than.
Okay, so you can definitely look into that. And do you have any allergies?
No.
No allergies. Are you on any medications?
Yes.
What are you taking?
Lisinopril.
Lisinopril.
High blood pressure.
Okay.
And that's it.
Do you ever take over-the-counter products or anything? Or
Vitamins.
Just vitamins? Okay. And you're taking the prescribed medication daily?
Yes.
Okay, sounds good. So next we're going to move on to your vital signs. So normally we would have an O2 saturation, and I would put that on your index finger. And since we don't have one, I can't measure it, but if she had any contraindications like dark nail polish, I could also put it on your ear, and that would also measure it. And then I would also measure your temperature, so either orally or using a thermometer across the forehead and on the face. And that should give an average reading of about 97 degrees Fahrenheit. And with the temporal thermometers, you can add an extra degree when compared to the oral ones. So next I'm going to move on to your pulses. So you have 8 pulses, just so you know. So I'm going to check both sides to make sure they're equal in strength, and I can feel them both, starting with the temporal pulse. Good, and then the carotid pulse, we just do one side at a time. Good, and then the other side. We just want to make sure that they're equal. Next, I'll move on to the brachial pulse, just on the inside of the arm. Good, and I can do the other side as well. Sometimes extending your arm helps. Good, those are bounding and equal. Then we can do the radial pulses, which are on the inside of the wrist, where the thumb is. Good, those are equal as well. And then I would measure the femoral pulse, and for that I would wear gloves. which is on the inner thigh, if you don't mind. And I'll do both sides of that as well. Good, and then moving on to the popliteal pulse. So I'm just going to bend your knee a little bit, which is behind the knee. And then the other side. Those are also equal. And then the last two, we have the pedal pulse, which is at the top of your foot. I'm just going to remove your socks a little bit. The left side is slightly more bounding than the right side. Good. And then the posterior tibialis. Good. And again, the left side is slightly more bounding in that one as well. I have cold hands. So I'm going to come back to your radial pulse and just double check that here. And while I was checking her radial pulse, I was actually looking at her respirations. So there were 15 in the minute. All right. So next we're going to move on to your cardiovascular assessment. Oh, also for the vital signs, are you in any pain today?
No.
No pain? Okay. If she were in pain, I would ask her how it was feeling on a scale of 1 to 10. And then ask further questions to see if anything made it feel better or worse after that. Okay, so now we'll do assessment. So I'm going to measure all of her heart sounds. She has 5 of them. I'm going to start in the aortic, which is on the right side in the second intercostal. Go under your shirt. And I'm just looking for the lub-dub sound. And then I can move on to the pulmonic, which is on the left side of the second intercostal. And then next is Erb's point. Which is in the third intercostal space on the left side. and then after that is the tricuspid in the fourth intercostal space. And then lastly, I'm going to check your apical pulse, so I'm just going to have to move the boob a little bit. And I listen to that for a full minute. And I got about 68 beats per minute, which falls within normal range. So I'm going to check your capillary refill as well. But her capillary refill is less than 1 second, so she has good peripheral circulation. I'm going to move on to the lungs. So for this, I'm just going to have you take not super deep breaths, but enough. I don't want you to pass out. So starting on each side. Okay. Okay. Good, so I listened to her 6 lung sounds on the front, on the anterior side. If you don't mind just sitting up a little bit, I'm going to listen to your posterior ones. Can you scooch a little bit more further? I just can't with the chair, I can't reach. Okay. Gonna listen to the 10 lung sounds on the posterior side. And just stay like that real quick. I'm coming to the right lateral side. I'll have you do the same thing. Take a few deep breaths. Good. One more. Good. And that's because the right side has 3 lobes instead of 2 on the left. Okay, you can lay back down and get comfortable. Actually, stay scooted forward and kind of lay down more, because next I'm going to be checking your abdomen. Alright, so first I'm just going to inspect the abdomen, see if I can visualize any distension, which I'm not seeing any right now. Do you know when your last bowel movement was?
After breakfast.
Alright, so you did go today? Okay, good. You're not feeling constipated or anything, and it was normal in size? Any diarrhea?
No.
Okay, good. So after inspecting, I can auscultate. So I'm going to be starting in the right lower quadrant and working my way around, listening for 5 minutes in each quadrant. I'm moving up to the right upper quadrant. And then the left upper quadrant. And the right lower quadrant. And when was the last time you ate?
Today lunch.
Lunch, so a while ago. That would explain for it not being super hyperactive. And then I'm going to be palpating a little bit, again feeling for any distension, or you can let me know if you feel any pain. It's just light palpation. Also including the bladder. Okay, good. I just want to make sure the video's still going. Alright, next I'm going to take your blood pressure. I should have done this when I was doing all your vital signs, but it's okay. Alright, so I'll put this. You can just relax. And then if you don't mind uncrossing your feet, that helps with the reading. 150 over 110. You said you take your blood pressure medicine every day?
Mm-hmm.
Could be too. Okay. Now I'm going to assess your head and neck area. Stay comfortable. So I'm just checking your scalps for any bumps or lesions. Everything looks good, everything feels okay. And then I'm just making sure everything's symmetrical, her nose, her eyes, and her lips. And then I can use my pen light. I'm just gonna check in your ears. And then the other ear, because we want to make sure everything's symmetrical or the same on both sides. Alright, can you open your mouth for me? Good, you don't wear any dentures. I'm checking to see that the oral mucosa is wet. There is some paleness, so I would say she's a little bit dehydrated. And then next I'm going to check your eyes. So if you can just look forward at the picture in front of you, don't look at the light. I'm just going to be shining the light to the side of your eye. And same thing. No, look forward, please. So
Sorry. I didn't know where I'm trying to focus on something.
Just look straight ahead. Good. So both eyes are equal and reactive to the light, and the pupils are symmetrical. Then I'm also just going to check your neck to make sure everything seems symmetrical on both sides as well. Good, and no pain or tenderness. Okay. So last we're going to do your muscular, or not last, but your muscular skeletal assessment. So can you put your arms up above your head? Good. And then out to the side. We'll put it back down and then out to the side. Okay, no pain with that.
Mm-mm.
And then can you grab my fingers and squeeze? Good. And then put your hands out in front of you. Good. And then put them to the side like this, and then push against my hands.
Oh, out?
Push out. Keep going. Good. And then like this, and push up. Good. And then push out at your elbows. Bend your arms a little bit. Yeah. Now push out. Keep pushing. Okay. Good. And then your legs are next. Can you extend one leg up towards you? And then put it out. And then keep it straight. And up towards you. Good job. And same thing with the other one. Bring it in and then out. And then back up. Good. And then bring one leg out and back in. Same thing with this one. Good. Alright, now point your toes and flex them. Good. Relax. Now pull your toes towards you. Good. Step on my hands. Good. Put your leg out to the side. Keep pushing. Alright. Good job. Alright, so we checked your active and passive range of motion. Everything was equal on both sides. And your legs and your arms had full range of motion. So your Glasgow Coma scale, I would give you a 15 because everything is within normal limits, so that's the best score you can have. And then last, I'm just going to do your skin assessment. So I was doing that while I was doing the head and face and was checking her scalp. I would check her arms and make sure all the bony prominences, the elbows, and then the heels on both sides. Good. And then if you don't mind sitting up a little bit, I would put gloves on for this and make sure her coccyx is good. There's no pressure injuries on the back side of her. So we're just looking for all the pressure injuries. your skin turgor, which is elastic. It's good with that. She has good skin temperature. I would give her a Braden score of 23 because there's no risk for pressure injuries. I just want to make sure you're comfortable. You have your call bell in place. I'm going to lower your bed back down to make sure that's good. It's still locked, and I'll be back soon to check on you.
Yeah.
Thank you.